Hi there, fellow social workers, social service practitioners, and academics. My name is Amran Jamil, and before I proceed further, I would like to wish everyone watching this a happy World Social Work Day. A big hello from all of us here in Singapore. We hope you are continuing to keep safe and strong wherever you are during this difficult period. I am here with my colleague, Ms. Ellie Kung Ashant, who will be co-presenting this lecture with me. Ellie, say a big shout out, please.
Hi, everyone. Thanks for having us.
All right, thank you, Alice. Before we begin our sharing, we would like to thank Dr. Hirata Michiko and team from the Japanese Federation of Social Workers for inviting me and Alice to be a part of this wonderful symposium and share with you our experiences in supporting individuals, families, and communities here in Singapore during this COVID-19 pandemic, with a focus on the experiences of our Family Service Center. Let me first do a run-through of the outline of our presentation. Right after this, I will do a brief sharing on both our backgrounds so that you have a better understanding about who we are before we give you an overview on Singapore's social policies. I will then introduce you to the concept of a Family Service Center, or FSC in short, one of the many social touch points in the community in Singapore, particularly the focus on our FSC, the Foundation of Rotary Clubs Singapore FSC. Then Alice will take over to share with you on the COVID-19 situation in Singapore, since the first case was detected here in January last year. She will also cover in brief the various government schemes that were quickly introduced and rolled out to support and assist Singaporeans through the pandemic. She will then share what our FSC has done to do our part in helping the community. I will then touch on the key social and community issues that we face at the FSC that were brought about by this pandemic, before Alice proceed to share on some of the challenges we experience in attending to these issues. Well, that seems to be a lot of topics to be covered within the next 40 or so minutes, and I hope you will enjoy what we have in store for you. All right, then I will begin with a brief introduction of myself and then about Alice. I'm currently an executive director with the Foundation of Rotary Club Singapore FSC for the past 7 years. My experience in social work spanned across 20 years, working in the youth justice system with families experiencing violence at home and multi-stress individuals and families. I graduated with a Bachelor of Arts, majoring in social work, and Master of Social Sciences in social work, both from the National University of Singapore. Now on to Alice, my colleague who has been with the FSC for 10 years. She is currently a senior social worker with over 10 years of expertise working with vulnerable children and disadvantaged families. She holds a Bachelor of Social Science in Social Work from the Chinese University of Hong Kong and Master of Arts in Early Childhood Years from University of London. Now, let me take you through a brief overview of Singapore's social policies. You will have already known Singapore as a small nation state, a little red dot that lies at the southern tip of the Malaysian Peninsula and at the heart of the Southeast Asian region. In 2020, Singapore's population was estimated to be 5.69 million, and we pride ourselves for being a very diverse and heterogeneous society made up of people from different ethnicities, religions, cultural backgrounds, and nationalities. As such, Singapore's social policies evolved over time since it attained independence in 1965 and even before that. Over the past 55 years or so, social policies shifted to focus on fostering a beneficial and meaningful tripartite relationship between the individual and families, the community, and the government that encourages personal responsibility and support from families, provides formal and informal support systems, as well as the safety nets needed to protect and uplift the vulnerable and disadvantaged persons and groups in Singapore. So with this, the Singapore Social Compact was envisioned to encapsulate all the principles, policies, and schemes that impact all Singaporeans. This ideology was founded on the principles of self-reliance, high growth, full employment, and a strong social security system that emphasized on individual savings and home ownership, has served Singapore well so far. This compact has resulted in growth, social mobility, and high standards in housing, education, healthcare, and public infrastructure. In June last year, the government announced plans to ramp up efforts to strengthen the compact through a three-pronged approach. Firstly, by ensuring everyone has the full opportunity to do well through education, skills, and having good jobs. Secondly, by boosting support for those with a bad start in life, so to promote social mobility and lessen inequalities over time. Lastly, by playing a role to strengthen solidarity among Singaporeans via fostering a society where self-effort is rewarded and everyone takes pride in their achievements. The Singapore Social Compact comprises 6 key focus areas, which are housing, education, healthcare, employment, retirement, advocacy, and social and community assistance. These are various policies, schemes, and grants that fall under each focus area to support and assist citizens from children and youths to adults, parents, families, individuals with disabilities, caregivers, and seniors. When COVID-19 struck us early last year, there was an urgent need for Singapore to then strengthen its social compact to meet the challenges brought about by this pandemic, as well as the immediate and emerging needs of its people who are affected by this unprecedented public health crisis that had swept through every corner of the world. This was echoed by Singapore's Senior Minister and Coordinating Minister for Social Policies, Mr. Tharman Shanmugaratnam, who said that Singapore must strengthen its social compact by helping those who have lost jobs to find work, by keeping social mobility alive, and by assuring Singaporeans that help is at hand when they meet difficulties. In the earlier slide, we touched on the social and community assistance as the six key focus areas in Singapore Social Compact. Many of the policies and schemes under this area are disseminated by the many different touch points in the community, from the government offices at the local communities to non-governmental agencies and grown-up initiatives. One of these non-governmental agencies that are supported by the government are the Family Service Centres, or FSCs. There are 47 FSCs located in all the major residential towns and estates in Singapore. The FSCs complement other social service agencies that specialize in providing help and support to different segments of society and across a multitude of issues. The core services include casework and counseling, group work programs, and community work and outreach. FSCs were first conceptualized in the 1980s to play a key role in building strong and stable families in Singapore. FSC services are open to all families and individuals, regardless of age, race, language, or religion, who are at different life stages, from couples, families with young children, adolescents, and seniors, and from various family types that include single parents, blended families, and multi-generational families. With the primary focus in serving the vulnerable and low-income families and individuals in Singapore, FSCs aim to help them achieve, ultimately, independence, stability, and resilience. So let me introduce you to our Foundation of Rotary Club Singapore Family Service Centre, or FRCS FSC in short. We are one of the 47 FSCs in Singapore. This FSC has been helping and supporting residents in Clementi and West Coast towns since it was established in 1997. Clementi and West Coast towns are located in the western part of Singapore. Our staff, mainly social workers, come from diverse ethnic and cultural backgrounds with varied language abilities and skills. This allows us to meet the different needs and requirements of the clients that we see here in Clementi and West Coast. On average, FRCS FSC saw about 600 cases in a year on issues ranging from financial or sustenance, parenting or marital, family violence, emotional or mental health, and elderly and caregiving. More than 35% of the registered clients that we saw last year earned less than $1,500 or USD $1,128 in monthly household income. In 2020, the top 3 presenting issues seen at the FSC were financial, emotional, and marital. The FSC has also developed group work programs and activities to complement is casework and counseling. So over the years, we have curated several signature programs that cater to adults and families, as well as another set of programs for children and youth. These signature programs are for adults and families dealing with issues ranging from single parenthood to coping with emotions and personal growth to supporting those struggling with alcohol abuse. There are also programs that promote mindfulness practices and encourage healthy aging among our seniors. Our FSC has also pushed out several signature programs for children and youth that include parenting support targeting low-income families with young children from 0 to 6 years old, through home-based interventions and activities that promote health and effective parent-child interactions and literacy. Other programs cater to children from single-parent families, as well as financial and material assistance for their studies. These programs, from psychoeducational to support and therapeutic in nature, aim at providing help and support to participants by enhancing their social functioning and skills through purposeful group experiences and learning more effective ways to cope with their issues. Given the safe management measures, group work had to be suspended from early 2020, but slowly and gradually opening up these programs that are within the allowed number of participants up to 10 now from late last year, and yet still able to maintain a safe distance. Eventually, group work interventions will be a very useful methodology as people look towards resuming social interactions and using this platform to better understand and seek solutions to their current issues. Now I hand over to Alice to share with you on the COVID-19 situation in Singapore and how the government and the FSC respond to this. Alice.
Hi, thank you, Amran. In the following part, I will talk about Singapore's journey through the pandemic and how the government support residents in the process. Right, Singapore saw its first COVID-19 case in January 2020. In 3 months' time, local cases and clusters started to emerge. There were outbreaks in foreign workers' dormitories. A multitask force was set up in January to prepare for a coordinated response. Guidelines were provided by the government on how we should implement safety measures. Due to a rapid increase in local transmitted cases, Singapore was put to a partial lockdown called the circuit breaker from 7th of April to 31st of May in 2020. During circuit breaker, most shops were required to close. Most employees had to work from home. Essential services such as clinics or supermarkets were still open. Schools had to close. Students were put on home-based learning instead. Family service centers like us were required to close as well. So our team had to work from home. So these two infographics were circulated to explain the rules during circuit breaker. These types of information were easily available through social media, websites, and newspapers. Well, Singapore entered phase 1 of reopening on the 1st of June 2020. For that to happen, all retailers and offices were required to set up a safe entry QR code for visitors to register their visits. Phase 2 of reopening started on 19th of June, and Phase 3 started from 28th of December 2020. There were gradual reopenings of shops, eateries, businesses, etc. We went through polling days and National Day celebration during this period. It was very memorable and a lot of safety measures were put in place. As our government introduced Trace Together apps and tokens, contact tracing became more convenient. This allowed most shops and facilities to be opened to public again. Family service centers are reopened since phase 1 with a split team arrangement. So in the slides, you can see the pictures and photos. Our polling day was made possible because of safe distancing measures, increased number of polling stations, and compulsory mask wearing. Our celebrations for National Day on the 9th of August were brought to the neighborhood to avoid the gathering of crowds. How did Singapore support the citizens to cope with the impact of the pandemic? Well, you may wonder how social services were responding to this sudden change. We would like to point out that the majority of support came from our government. The idea of social compact, introduced by Mr. Amran just now, demonstrated how the Singapore government adopted a holistic view on how to use social policies to support citizens. During the crisis of pandemic, Singapore government adopted what Low in 2020 called a whole government approach, where all relevant ministries and departments work together, coordinated by the multi-ministry task force, which were led by 2 ministers. The government's support has been timely, responsive, and appropriately targeted. Some examples of cross-ministry collaborations include using police to conduct contact tracing. Ministry of Health and Border Controls work together to bring visitors to quarantine. Ministry of National Development to find accommodations for quarantine purposes, etc. The focus on border control, isolating community cases, support to affected families and businesses, and maintaining basic livelihood are very, very clear. Between March and June 2020, 4 budgets were implemented to support different relief schemes. There was a one-off cash relief for all Singaporeans and PRs, specific financial assistance for individuals who lost their jobs, receive less income or being put on no-pay leave. Support for citizens being put on stay-home notice and quarantine, and support for businesses to sustain and avoid terminating their employees. Beneficiaries of various assistance before the pandemic were extended their assistance, sometimes with higher quantum. So as you can see, a single website has been set up for residents to find details of all the relief programs available. Efforts were also ramped up to help citizens to get employment. Job information was made more accessible through roadshows and online information. During the pandemic, the most prevalent need was financial needs, where a lot of citizens lost income due to business closures and downsizing. For individuals that fall into financial hardship, social service officers were appointed as the main touchpoint for applications of relief schemes. While most social services were still accessible through calls, the government started a national helpline for easy access to counseling services. The helpline was manned by social workers and counselors who took leave from their work on a voluntary basis. 2 of our staff volunteer in this service too. And during and after the circuit breaker, some groups were more affected than others. The obvious example would be elderly living alone. The usual visitation service and gathering with friends were stopped. There were ground-up efforts by volunteers to help them with the grocery shopping and meal deliveries. Some gathered resources to put migrant workers who were unable to go out or return to their hometown due to border closures. Many small but significant efforts like these sprung up in 2020. Well, some concerted efforts or enhanced services were also seen. For example, there was a spike in homeless cases as the usual dwelling places became saturated or unavailable. People might be kicked out of their homes after a fight with their family members. So the Ministry of Family and Social Development started a special office to coordinate vacancies in shelters and to source for temporary shelter to cater for the needs. The Institute of Mental Health, Singapore's main mental health hospital, has strengthened its crisis intervention service and capacity to keep patients in the hospital during the pandemic. Next, I'm going to share how our FSC operate during the pandemic. As the Multitask Force was established early in the pandemic, we had been receiving clear guidelines from MSF on safety measures of all social services. Measures such as safe distancing, temperature checks, protective gears, and sanitizing stations were set up. The situation was slightly uncertain before the circuit breaker was imposed. Remember, there was a global shortage of masks and sanitizers and protective gears. Our team had a hard time sourcing them too, but we managed with a team effort. Our government started a contact tracing system called Safe Entry. All visitors had to register their visits using a QR code. Well, noting the spike of cases in February and March, we gradually halt our home-based interventions, groups, and non-essential visits. Well, we did a lot to prepare for circuit breaker also. As we are aware there will be this partial lockdown, we were also busy preparing for the essentials. SIM cards were provided for our social workers to contact clients through calls and WhatsApp while working from home. Our team also delivered 2 rounds of food ration and financial assistance to the homes of our clients to ensure timely help and maintaining of contact. Our team put in effort to source for the appropriate software for virtual meetings. We tried Zoom, Microsoft Teams, Cisco Web-based, and we became rather good at them. During circuit breaker, we were all working from home. As most of the relief efforts were channeled to social service officers, we played the role of linking resources to our clients by finding the right support for them during the pandemic. For example, checking with clients to see if they had laptops and Wi-Fi for the children to receive their home-based learning classes, and to link them up with laptop donors. We will conduct visits for crisis intervention with safety measures in place. We are proud that 2 of our staff volunteered to help with the National Counseling Hotline in their after-work hours. Besides having meetings over calls and video conferences, we took the effort to check in with other staff regularly to ensure the team support and morale was still strong. After circuit breaker, circuit breaker ended on the 31st of May 2020. When we entered phase 1 of reopening on the 1st of June, FSCs were open again. From June until now, we are working on split teams. We have 2 centers under FRCS, and the team for each center was split into 2. So each team would be in office for 5 days and work from home for the next 5 days. We have about 5 to 7 staff in each split team. We have clear instructions on how to maintain safety for staff. Meetings between staff were conducted online if members come from different split teams. As much as possible, staff with different centers do not mix. We started modifying our internal processes to reduce contact. For example, e-signatures of forms, submissions through emails. Safe distancing is observed if there are needs for physical meetings. We are able to take in placement students with all the safety measures in place. They join our meetings online and work with the same restrictions as we need to face. Well, how do we keep our clients safe? First, we are required to register all visitors through the Trace Together apps and the safety entry tokens with temperature checks and health declarations. So safe distancing of 1 meter is observed within our center. We are also required to ask for health declarations in home visits. So masks will be put on at all times when we're facing clients. So standard operating procedures to handle visitors or staff with symptoms are in place. And all these measures were audited every 6 months by Ministry of Social and Family Development. Well, in terms of running out of our center, we are also slowly back to normal. Split teams arrangement and work from home arrangement are still ongoing. We resume group work and programs. Safety measures put in place that compliance to guidelines. Our home-based intervention has resumed with mask sanitizers and health declaration in place. So some changes were here to stay. For example, digitalization of processes, Zoom calls and meetings, and more flexible work arrangements to include work from home options. So next, I'll hand it back to Amran to introduce new needs that we are facing now.
All right, thanks, Alice. So let me move on to the social issues faced during the pandemic that we experienced at the Family Service Center. COVID-19 pandemic has undoubtedly brought a lot of social issues to the fore. Given that this is an unprecedented situation for all of us, that we do not know for sure how long this is going to last. It has certainly caused a lot of disruptions to our normal day-to-day lives and forced us to rethink and to some extent relearn the way that we conduct our lives, businesses, studies, and work. Whether we like it or not, or whether we are prepared, technology is set to be a big part of our lives from now on. And we are pushed to utilize technology even more as we continue to keep a safe distance from each other. Working, studying, and doing things remotely have become the default practice now. With our society facing the COVID-19 pandemic, I must say, based on our observations at the Family Service Center, that we are a little unprepared for all these changes that overcame all of us, all too sudden. I think the ones that would have borne much of the impact of these changes will be the vulnerable and disadvantaged in our community. Based on our FSC's experiences during the past 1 year during this pandemic, we have seen an increase in the number of cases presenting with financial issues, which often caused by unemployment due to retrenchment and difficulties in finding a job, especially when many places were cutting back on hiring or companies were folded. There was also an increase in the number of family violence cases. As families were forced to work from home, the interactions between family members, especially spouses, became even more often, and sometimes more arguments can also arise. The interactions became more tense and may escalate to verbal and proceed on to physical aggression. Victims of family violence may also feel more trapped during this period, where they were unable to leave home easily and get the help and support they need faster. The concern was also for children who were witnessing more arguments and aggressive behaviors between parents and adult members at home during this period. With more tense arguments at home, marital and parenting issues also became more apparent. Parents had to deal with issues managing their children's behaviors as they stayed and attended online classes at home, coupled with parents themselves having to be stuck at home working. Issues involving isolated elderly and stress and burnout among caregivers of elderly and those with disabilities were also on the rise during this pandemic, as children were unable to visit the elderly more often due to stricter social distancing measures in the beginning of our response to the pandemic, and the elderly themselves were not encouraged to go out often and socialize. They were definitely feeling isolated, and them getting their needs met became slow and arduous. During these challenging times, caregivers were looked upon even more to assist and support the vulnerable persons in the community. There were mounting expectations on caregivers, and this, of course, led to ease of them getting stressed out and being burnt out. Other issues that came out even more during this period were increase in the number of cases presented with mental health concerns and deterioration of mentally ill persons living in the community. Being cooped up at home and socially constrained even more, feeling isolated and not being able to do things that we were all used to doing before this may increase the risk of us getting sad, angry, frustrated, and depressed easily. These are many of the social issues that we came about at the FSC, and we have to respond to them as we go along. So I now hand over to Alice to bring us through the challenges that we face as an FSC. Alice.
Thank you, Amran. Well, we are facing a lot of challenges during and after the pandemic, but service still goes on. Here are some of the challenges and how we cope with them. First, we are limited in resource and manpower. During the pandemic, we were unable to reach out to our clients as much as we would like to. Due to split team arrangement, the manpower in the center is reduced, limiting our accessibility and the ability to respond to crisis. Fortunately, a significant part of this challenge was met by the concerted responses from the government and the civic society. Government relief schemes cover a range of needs and were made very accessible to all. So again, we see the results in the whole government approach. There were also a lot of initiatives from voluntary groups. They were creative, mobile, and responsive. They mobilized online to cater different needs, such as making masks, delivering meals, giving out laptops, offering tuitions, etc. So with these supports, we could focus on maintaining contact with our client and linking them up with the various resources. Well, our second challenge was to deliver service through remote means, such as calls or video conferences. We relied on our face-to-face skills to engage our clients, and our team do not have the same level of IT literacy. So it becomes a challenge for some of us. To meet this challenge, we designated a staff to plan for our digitalizing processes. There were training for staff to be familiarized with the software we are using, and SIM cards for staff to call clients from home. The sector has also been organizing themselves through training and sharing sections so we can learn from each other's experience. Fortunately, most of our clients have a mobile phone, and a significant number of them have Wi-Fi access. Some of our clients may not be able to handle video calls, but most welcome our workers' call. Realizing that the pandemic will not go anytime soon, we just went on with these limitations. In the end, both our team and our clients got quite used to it. We feel like we are learning with our clients to cope together. Well, some needs emerge as a result of circuit breaker, border closures, and being at home for extended period of time. A study conducted during circuit breaker found that more clients served by the social services showed problems in financial issues at the beginning, but as time went by, mental health issues, spousal violence, family issues, and employment issues emerged. We also experienced a spike of homeless cases, some as a result of border control, but also related to family conflicts. While we tried our best to support our clients with what we could do, we found a lot of support from our fellow practitioners in different settings. For example, social service officers, being the key touch points of relief schemes, encounter a lot of new cases which were referred to our center. They would extend their help to visit the home with us and to support us in linking up with internal resources in the government. New services such as mental health team for seniors emerged to work with established agencies such as FSCs. We are very excited to see all this new development. And also there is a National Council of Social Service Task Force is formed in January and to promote and support digitalization of social services. Some organizations are working hard to come with information and strategies for future service planning. For example, the National University of Singapore Social Service Research Team has been collecting data from frontline workers on the issues on the ground to inform services response. And just now I mentioned the National Council of Social Service has established a new task force as early as Jan 2020 to prepare social service agencies to meet the challenge of the pandemic and beyond. So our last challenge we want to share with you is the challenge to maintain staff morale. Due to split teams and work from home arrangements, we are now meeting only half of our team when in center. So this is a big contrast to the previous work environment where everyone can mingle and provide support to each other when needed. We try to bond as much as we are allowed to. For example, we ensure that supervisors check on the supervisees regularly to provide support. We also gather and have fun through Zoom celebrations and when safety measures allowed. This is important to have fun time together. So I'll pass back to Amran for a summary. Amran, please.
All right. We hope that our presentation has shed some light on the responses that were meted out to support and help individuals, families, and communities during this trying period. In summary, we have looked at Singapore's whole of government approach and responses as it provided the safety nets for its people and how community agencies like our FRCS Family Service Centre played a role in supporting and carrying out initiatives to strengthen the safety nets at the local level. We have also touched on some of the social issues brought about by the pandemic that the Family Service Centre saw over the course of that 1 year, and the work done to overcome some challenges as we push ahead during these trying times. Well, that's all we have for you today. Thank you once again for having us. Alice and I wish all of you the very best, and again, a happy World Social Work Day 2021. Take care. Bye-bye.